administered by the state with physician participation, and used methods such as gas, lethal injection, and starvation. Below is a clear, court-ready primer that explains Akiton T4, and then situates Canada's medical assistance in dying MAAD regime, especially controversies involving veterans, people with disabilities, and the current mental illness addiction. Number 1, what Akiton T4 was. Factually, Akiton T4 was Nazi Germany's centrally planned program to forcibly kill disabled people, adults and children, beginning in 1939. It was non-consensual, administered by the state with physician participation, and used methods such as gas, lethal injection, and starvation. Historians estimate at least 70,000 were killed in the formal T4 phase by 1941, and well over 200,000 to 250,000 when counting subsequent decentralized killings, USHMM 2020, USHMM 2020B. The core features were coercion, secrecy, and a eugenic ideology labeling people unworthy of life. This is categorically different from any modern rights-based end-of-life law premised on voluntary consent, USHMM 2020, USHMM 2020B. Number 2, Canada's Maid, what the law actually allows today, legal basis and scope. Maid became lawful in 2016 for capable adults who meet strict criteria, serious and incurable condition, enduring intolerable suffering, informed and voluntary request, additional safeguards, Justice Canada 2025, Health Canada 2025. Track 1 versus Track 2. Since 2021, Bill C-7, MAID is available both when death is reasonably foreseeable, Track 1, and when it is not reasonably foreseeable, Track 2, with extra safeguards under Track 2. Justice Canada 2025, CMAJ Duong 2023. Mental illness as the sole underlying condition. Parliament delayed eligibility for MAD, where mental illness is the only condition until March 17, 2027. Bill C-62. Royal Assent, February 2024. Until then, a person cannot receive MAD solely for a mental illness such as major depression, personality disorder, or a substance use disorder. They may still be eligible if they also have a qualifying physical condition. Health Canada, 2025, Parliamentary Research, 2024, CAMH, 2025. Numbers. Health Canada's 2023 national report recorded 15,143 MAID deaths, about 4.9% of all deaths, with detailed counts of ineligible requests and withdrawals, evidence that applications are screened and many do not proceed. Health Canada, 2024. Number 3, where the current Canadian controversies arise. A. Veterans. In 2022, a Veterans Affairs Canada BAC employee inappropriately raised MAD with veterans. VAC investigated 402,000 files, confirmed 4 cases tied to a single employee, now gone, issued apologies, and mandated national staff training and guidance that VAC staff must not suggest MAID. Any discussion must be redirected to the patient's primary care team, VAC 2023, VAC 2024A, VAC 2024B. B. Disabilities, poverty, homelessness. Peer-reviewed and journalistic investigations report instances where social determinants, poverty, housing, isolation were prominent in MAD. What Mr. O'Neill is remembering is absolutely real. Historians have shown that Nazi officials did run the numbers and justify Akiton T4 as a budget-saving measure for mental hospitals. Here's how to frame it clearly. 1. Costing out the burden of patients. Long before the gas vans, Nazi racial hygiene propaganda taught the public to see disabled people as a drain on state finances. One of the most famous examples is a 1930s poster from the Nazi magazine Neues Volk that reads, open quote, 60,000 Reichsmarks is what this person suffering from hereditary defects costs the community of Germans throughout his life. Fellow citizens, this is your money. World War II, in color. That 60,000 RM figure wasn't random. It was based on internal calculations of the lifetime cost of institutional care, food, staff, buildings, clothing, medication, for a chronically ill patient in a state asylum. Historians of Nazi medicine point to these figures as the bridge between hospital budgets and the idea of lives unworthy of life. Proctor, Friedlander, Burley. EPDF.pub2, explicit economic rationale in the scholarship, close quote. In his essay, Eugenics in Hitler's Germany, in Deaf People in Hitler's Europe, Robert N. Proctor writes that the fundamental argument for forcible euthanasia was economic, describing euthanasia as a kind of preemptive triage to free up hospital beds and resources, especially once the war began. Proctor. EPDF.pub, Michael Burley's monograph Death and Deliverance, Euthanasia in Germany c. 1900 to 1945, opens part 1 under the heading Saving Money, Spending Lives. He traces how Weimar-era and Nazi-era asylum administrators complained about overcrowding and rising per-patient daily costs, and how killing patients was sold to officials as a way to relieve budgets and free space for productive Germans and war casualties.
Disgusting.
Internet Archive, Henry Friedlander's The Origins of Nazi Genocide, From Euthanasia to the Final Solution, pulls the threads together. The T4 program is shown as the financial and bureaucratic prototype for the later industrialized murder of Jews in Roma, including the same staff, gas chambers, crematoria, and accounting mentality that weighed cost of care against value to the Volk. The University of North Carolina Press, 3. How they justified it inside the system. Inside the bureaucracy, the argument ran roughly like this. State hospitals and nursing homes were overcrowded and underfunded. Records from facilities like Hadamar show per-patient daily costs being tracked carefully and administrators under pressure to cut expenses. EPDF.pub, war meant more wounded soldiers and bomb victims needed beds. Killing incurably mentally ill or disabled patients would free up beds and staff for the war effort, explicitly framed as rational resource allocation, not murder. EPDF.pub, propaganda posters and films then translated those internal budget lines into public messaging. Each disabled person equals tens of thousands of Reichsmarks wasted, so killing them becomes a patriotic, economically sensible act. So when Mr. O'Neill refers to a book that showed they literally calculated the savings from Akiton T4, he is essentially pointing to the body of work represented by Burley's Death and Deliverance and Friedlander's The Origins of Nazi Genocide, plus Proctor's essay. Together they document that, open quote, the euthanasia of institutionalized disabled people was defended not only in racist or pseudo-medical terms, but also in spreadsheet terms, as a way to cut mental health budgets and reallocate funds and beds to useful citizens and soldiers. Close quote. That is the precise historical parallel he is flagging when he warns that present-day policies which put a price tag on the lives of disabled, homeless, or addicted people are walking on pre-Holocaust ground. Works cited. Selection. Burley, Michael. Death and Deliverance, Euthanasia in Germany c. 1900 to 1945. Cambridge University Press, 1994. Internet Archive, Friedlander, Henry. The Origins of Nazi Genocide, From Euthanasia to the Final Solution. University of North Carolina Press, 1995. The University of North Carolina Press, Proctor Robert N., Eugenics in Hitler's Germany. In Donna F. Ryan and John S. Schuchman, eds. Deaf People in Hitler's Europe, 1933 to 1945. Gallaudet University Press, 2002. EPDF.pub. Euthanasia poster, 60,000 Reichsmarks is what this person suffering from hereditary defects costs the community. Neues Volk c. late 1930s, reproduced in multiple archives, World War II in color. You're right to say that doesn't feel like consent, and there is solid human rights and ethics scholarship that backs Mr. O'Neill up. 1. Two different answers. Legal versus human rights reality. In narrow Canadian criminal law terms, Maid is treated as consensual if the forms are signed, capacity is present, and no one is overtly threatening the person. On paper, the state says this was a voluntary, informed request. From a human rights and disability justice lens, consent is not real if the state has deliberately kept someone in poverty, stigma, homelessness, untreated pain or trauma, such that death looks like the only rational option. The Canadian Human Rights Commission has already said this in almost the same words. They are deeply concerned that people with disabilities are choosing AD because they cannot access the basic supports and services they need to live with dignity, and stress that ending one's life must be a true choice, not one forced by lack of supports. Canadian Human Rights Commission, 2024. Canadian Human Rights Commission. A House of Commons committee heard disability witnesses explain that many are effectively given